Are you a physical therapist interested in cash pay physical therapy and you find yourself thinking, which courses should I take to improve my clinical skills so that I can get more cash pay patients onto my schedule? If you are, you're in the right place. I'm a specialist in helping cash pay PTs just like yourself improve outcomes and really enjoy the career that they've always dreamed of in cash pay physical therapy. When we look at clinical skills, most of us have been trained through PT school or traditional insurance style clinics to focus on clinical skills, and that's what improves outcomes in a traditional insurance-based setting only. In a cash pay setting, it's completely different. I created something called the cash pay triangle. What this includes is there's 3 pillars to work with a cash pay patient. Number 1 is who. Who is your customer? Who is the cash pay patient? Is it a 25-year-old college student? Is it a 16-year-old high school student? Is it a 45-year-old mom or dad? In that case, you have to understand, what does that consumer want? You have to understand who you're serving and what they do on a regular basis from a fitness standpoint, from a recreational standpoint, from a job perspective. All that creates a huge profile to understand who you're serving because it changes how they process decision making. Number 2 is what you're going to deliver. That's what PTs focus on the most. What's the clinical skill that you're going to apply to this knee, to this back, to this shoulder? Once you understand that, that's very simple. You fix the knee. That is the traditional model. What am I going to do to this joint? That is very common. We talked about who. We talked about what you're going to do. The last part is the message. The message is, how do you convey to who, your patient, that this knee is not working properly? You might say, well, I've done that for a long time. I did it on my clinical rotations. I did it in my traditional insurance-based setting. That's very different when you enter a cash pay setting. These 3 things you must hone in on and obsess about, because if you cannot get these 3 things dialed in, you will fail in cash pay PT. You might get 1 or 2 patients. You might get a full caseload for about a week, a month, but you will be challenged with frequent turnover, self-discharges, because you don't understand these 3 concepts. First, most importantly, is to understand the consumer. Who is it that you enjoy working with? Who loves to be around you? How do they find you? Why do they go to you over anybody else? Understand this. Then, clinical skill-wise, you're not going to have a problem. Why? Because you have enough skills. But this is what you will obsess about and try and get more and more CEUs so you can get better thinking that that's the thing that's going to help you. And then lastly is that message. How do you communicate effectively, concisely? Can you describe why this person has pain in 10 seconds or less at a 6th grade level? This is what it usually sounds like. Hi, Mary. Your gluteus maximus is weak. You have poor hip internal rotation. You have poor lumbopelvic control, and it's going to take us 3 to 6 weeks, 1 to 2 times a week. And here's your 4 to 6 exercises. What questions do you have? You're confused listening to this video, doing that exact same thing. Can you imagine a patient who knows nothing about healthcare or medicine taking that exact statement and thinking, this person can solve my problem? So even if you understood who your customer was and what skills you had, that message has to be crystal clear, and it has to be that at every session. And that's why people come back. That's why PTs are successful in a cash pay practice. If you try and apply insurance-based approach with clinical skill with no effort into who the person is and the message, you will fail. And I don't want to see you do that. So if you're looking to improve your cash pay service and you're thinking of which CEU should I take, you don't need them right now. What you need to do is focus on people and managing expectations and leadership and helping people understand why you do it and effectively communicating that. That is where your effort needs to be for your cash PT practice.